Hello everyone, I'm Dr. Y. Coney and welcome to Bright Star Baby and Child Clinic. In this video, I would like to talk a little bit about constipation, which is a fairly common occurrence in my clinic. I will go through some causes of constipation as well as ways to recognize it and ways to manage it. First of all, I would like to mention that our bowel patterns are quite variable. Most people think that we have to go to do our bowel movements every day. So a daily occurrence is a must. But honestly, as long as your stools are passed without any difficulties or pain, then that's considered a normal bowel pattern. You don't have to go every day. As long as it's nice and soft, easy to pass, and you have no pain, then it is considered a normal bowel pattern. We are all humans, we all have different habits, different personality traits. So why not our bowels too? But what is the definition of constipation? The definition of constipation is that a person passes very dry, hard, and painful stools that are quite infrequent. It can occur daily, so even if you go to the bathroom daily to have your bowel movements, and yet each bowel movement is very painful and difficult to pass and very dry and hard, that is considered constipation as well. The problem of constipation is actually temporary, and it can be treated fairly easily. And the one thing I want you to know is that it's very common. Now, what are the causes of constipation? One of the causes of constipation is that the person's diet is very low in fiber as well as fluids, because these things make the stool softer and also heavier, so it's easier to pass when there's a bit of weightage to the stools, okay? So a diet low in fiber and fluids or water content. The other cause is that some of the experts think that early toilet training may be a cause of a child's constipation. So early toilet training leads to the child being not ready to go to the potty to have their bowel movements. And because of that, they get fearful of going to the potty, which leads to them withholding their stools. They can be because they are too young, or they are just not ready to go to the potty yet. All right. Another cause is cow's milk intolerance. So if a person is unable to digest cow's milk properly, it may lead to constipation as well. Another cause of constipation is having an illness, which leads to loss of appetite. So when you have loss of appetite, you have less food that goes into the digestive tract, which leads to not much weightage in the stools. And because there's not much weightage in the stools, hence it leads to constipation. Another reason for constipation is if the person or the child is on certain medications, for example, antihistamines, as well as iron supplements. Certain rare medical conditions can also cause constipation. For example, hypothyroidism, diabetes, some bowel obstruction, as well as nerve problems in the gut may lead to issues with constipation. Other reasons could be that, we mentioned this slightly before, any reason that causes a child to withhold their stools. For example, they have pain around the anal region, or if they have a rash around the bum area, it may lead to them withholding stools. Another reason is in children that are around 2 to 5 years old. They might be trying to exert their independence as well as their control. So they may use this way to say, no, I don't want to go to the potty, because they are trying to show that they are in control. So sometimes it may be difficult for them to listen to what you're trying to say. So you ask them to go, they may not go. So that may lead to them withholding again. So that may be a cause of constipation. Another common cause is that the child may be too immersed in their activity or too busy playing until they miss a chance to go to the bathroom when they're supposed to go. So that leads to the stools being backed up as well. Now, some of the other causes would be anything that changes the child's routine. For example, if they're away from home, if they're traveling, they don't like to go to an unfamiliar toilet. Their eating patterns also change. And sometimes when you're traveling, you don't eat as much, fruits and vegetables and fibrous things. Or not drinking enough water is also a common thing. Any changes in their routine may lead to constipation. Another issue is that if they have a major stress in their household, so any stressful situation may lead to the child be constipated. Now, the problem with constipation is that it's a vicious cycle, isn't it? So first of all, you have that hard stool that makes you have a lot of pain. And because of pain, what the child does is that they try to avoid this pain by keeping it in. So they withhold the stools, and the more they withhold the stools, the drier the stools and the harder the stools become, right? Because it stays in the intestinal tract longer. And because of that, it gets harder and bigger, and then more pain, more withholding, bigger stools. So on it goes until the stools become very backed up and very blocked up, okay? What are some of the symptoms of constipation? As you well know, it's basically difficult to pass stools, okay? So the child may strain, may cry. Of course, skipping a day or two of going for bowel movements, that's another sign. So hard stools is another one. The child may complain about tummy pain, nausea, cramping. They may feel very bloated, or they may look very bloated as well, their tummy. There may be very poor appetite because they are so backed up. Sometimes they may even have bleeding from the anal region, which leads to sometimes when you wipe with the toilet paper, you may see some blood on the toilet paper, so that's also one sign. Cranky behavior, not acting as usually. Sometimes they may make those, like they cross their legs. They may make uncomfortable faces, making faces. They may clench their buttocks, or they twist and turn on the floor. These are some of the signs. You think that they want to go to the bathroom, when in fact they're actually trying to keep their stools in. It's because of the pain. They're trying to avoid the pain. Remember I told you the vicious cycle? So they do all this clenching motion, funny faces. It's because they are withholding. Another thing is that they may have, their underwear may be soiled with some poo. That's another sign of constipation. There's a condition called encopresis that is associated with constipation. Encopresis is basically a condition where these children, they withhold their stools until there's a big stool plug at the rectum. And because of that, the stretching of the rectum makes that area of the gut less sensitive to any incoming stools, because they're so stretched that they can't stretch anymore. So what happens is that incoming stools from the top, the still watery ones, they will leak around that hard stool, that hard plug, and leak out from the anus. And so parents think that, oh, how come my child has diarrhea? Actually, that's not diarrhea. That is just the leaking of the stool from the top around the very hard plug. Okay, so this is called encopresis. It is considered a more severe form of constipation. So how do you treat this condition? How do you treat encopresis? In fact, how to treat encopresis is kind of like the start of the treatment for constipation. Okay? So basically, you have to get rid of that stool plug by using oral stool softeners from the mouth, so orally, and together with a suppository or enema from the bum. So you treat from top and bottom. From the bottom, you treat it because you want to remove that plug. If you don't remove it, there's no way that your child will be able to push down that stool, because it's too big and too hard and painful that it is impossible for them to remove it all using their own might. So you gotta give medicines orally, so stool softener as well as an enema to remove the plug. And in the meantime, also try to maintain good dietary habits, meaning continue with drinking lots of fluids, eating lots of high fiber foods, and being active. Some of the experts also think that behavior modification may help these children as well. These children, they have a fear of going to the toilet to have their bowel movements because of the pain, right? So these are built up over the years. So they will have a fear of going to the bathroom. So we'll try to modify this behavior so that they actually feel like, going to the bathroom is a good feeling. I should go to the bathroom more often. So it's a way of sort of modifying their thinking. Eventually, we do want to wean them off medications. However, the oral stool softeners are still considered quite alright, quite safe. It's just that we do not want any patient to be dependent on the rectal medications, the rectal suppositories. Basically, the main theme of managing constipation is, first of all, not to have it in the first place. Dietary changes is a must, and that should be maintained throughout life. Lots of fluids, fiber, and also taking some good probiotics may help your child overcome or prevent constipation. Okay. If you suspect your child may have a cow's milk intolerance, do consider talking to your doctor about switching formula. The other ways of managing constipation is, if you must take medication, it is quite safe to take stool softeners like we call them laxatives, but it's actually stool softener. It makes the stool softer by pulling water into your gut and making the stools softer and heavier, so it's easier to come out. So stool softeners can be taken on a longer term basis because it helps to maintain good bowel functions. So you can continue that one, but only occasionally I would recommend using enemas or suppositories, because those are just to remove the plug, okay, the short-term relief of that big stool plug at the end of the gut. We don't really recommend using it for years and years or so frequently, because there may be an issue of dependence. I hope the above video helped you a little bit on your understanding of constipation and how to manage it. Well, I hope you have a good time watching the video. And if you have any questions, do leave them in the comment section and I'll answer them. Meanwhile, have a good day and I'll see you next time. Bye.